Hey, Dr. Joe here. Today, I want to cover one of the biggest questions that I get on a daily basis in practice, and also one of the greatest sources of frustration that clients and patients share with me as they navigate the medical system for their chronic issues. And the question is, hey, we're looking at these particular labs here, and you're telling me that these labs are very significant and that they matter. And my other doctors don't seem to care, or they don't think that they're relevant in any way, shape, or form. And so basically, I have some doctors that don't really think that this is relevant, and they don't really also have an answer for my chronic issue. I'm still searching, and you're telling me that they're completely relevant, and it kind of matches up with what my ideas are, that I'm not quite right. But why can't you two get along? Like, why can't you seem to get on the same page? So I want to do that through a case to kind of exemplify what it is I'm talking about. So the case is a woman with a chief complaint of memory issues, or is concerned about cognitive decline and attentional issues. So a couple different cognitive domains are negatively impacted right now. Her quality of life isn't where she wants it to be. And she has a history of thyroid disease and wants to know if there's anything that she can do with lifestyle to help support what she's trying to do with her treatment of thyroid disease, which is medication. So we investigate a little bit about what's going on. So typically what I'll do, if folks haven't had labs run or comprehensive labs run in a while, I'll do a lab test. And so this is what came back. One of the findings, you can see down here in bold and black that there are some elevations here. And the things that are elevated are enzymes that could be related to the liver or the heart or bone or kidney, or the lungs, okay, or liver, like striated muscle, okay. But basically they're kind of grouping around the liver. Now, here's the significance of liver pathology for things like cognitive decline. Basically, the liver is connected to the brain via this really big nerve called the vagus nerve. And like it's a direct connection. It's like a freeway, an autobahn between these two areas. And when there's inflammation in the liver, that inflammation travels right up to the brain and then ignites the brain on fire. So if the person didn't have neuroinflammation or encephalopathy or encephalitis already, they will. And one of the number one symptoms of brain inflammation is brain fog, memory issues, lack of motivation, numbness and tingling, dizziness, weakness, arms feeling heavy, vertigo, acid reflux, depression, anxiety, insomnia. And those things tend to be made worse by things like not getting enough sleep, overdoing exercise, not exercising enough, alcohol, exposure to specific food proteins that they know they react to, or specific chemicals. And that person might, like, for example, get into an Uber or an elevator or go to church and they're exposed to perfume and they have a migraine for 4 days, or they just need to lie down. They have brain fog. They can't keep their eyes open, for example, that kind of stuff. That can happen on a spectrum of mild, moderate to severe. So essentially, for her cognitive issues, this is tantamount to a home run. Now, what's driving this? Why is that? Well, we need to figure that out. So my recommendation was to go back to her primary care doctor and get an isoenzyme study. So this LDH actually is a composite or a combination of 5 different chemicals all in one. And so you can see that that's the most egregiously elevated of these 3. And so we want some clarity on which one of those 5 is the big ticket item. It could be that it's much like these 2, it's liver, but we want to be sure. Okay, now there's other indications on her labs, and we'll talk about this more later as part of the case study, that it likely is liver, but it also could be other tissue because LDH is not specific to liver. So here's where some of her frustration happened. I sent her back to her primary care doctor to get an LDH isoenzyme study and an ultrasound. Well, why did I send her back? Well, A, because I can't treat hepatitis as a chiropractor. And B, because this could be a serious pathological issue that requires medical intervention. And C, because her insurance would cover it if her medical doctor ordered the test. So I could definitely order a liver ultrasound at a diagnostic facility. I could order an LDH isoenzyme study, but her insurance wouldn't cover it if I ordered it. So I sent her back to her primary care doctor, and we never got a chance to connect on the phone, but I just sent her back to her doctor. Now, her doctor looked at these tests and immediately said, these tests really aren't valid because they didn't come from our facility. Now, these tests were run at LabCorp, which is a nationally certified, credentialed, legit blood testing company. And so this is just, for my opinion, it's super annoying. And for the patient, it's also annoying because now they have to go in and give more blood when really they didn't have to, other than we wanted them to run an isoenzyme study anyway. But my point is, this test is not illegitimate because it didn't come from your office doctor. And that's not a common thing. So this isn't me attacking this doctor at all. Okay. But what I'm trying to do is illuminate a frustration that patients have and that doctors have, and explain a little bit about where that's coming from by going through something called the selective attention test. Okay. So that's kind of where we're at. So I sent her to her primary care doctor. The primary care doctor said, yes, this doesn't look great. However, I can't trust this lab, so we need to run other tests. And the tests came back. They were elevated. Now, she didn't run the isoenzyme study because this doctor didn't seem to feel that LDH was a problem here. So again, the doctor didn't think it was a problem. I think it's a problem. And the patient is understandably frustrated, also is experiencing executive function issues, memory issues, and attentional issues because she's so inflamed, doesn't really have all of her faculties available, is completely confused, and is lost and doesn't know what to do and is frustrated. So is sharing that with me, but in a nice way, actually. Now, what the heck is going on? And so why is it that when you're working with me or with other doctor that maybe isn't in the standard medical model, that it seems like when I look at a test and I see things that are bold and elevated, I think they're a problem or a potential problem, or that they need to be investigated aggressively. Whereas another doctor may look at them and go, it's no big deal. Okay. And essentially what came back was the liver enzymes were still elevated, except for LDH wasn't run on the additional testing. The ultrasound on the liver was not run. And a hepatitis panel was run, which was great. So we ruled out hepatitis. The reason I didn't order a hepatitis panel was because her white blood cell count was normal. So typically when white blood cells are normal, hepatitis panel would not be indicated. However, I still think it was a good idea to at least rule that out. Okay, so why is it that so many doctors disagree on facts and disagree on what actually is happening and disagree on what's important to look at? So let's take a quick look at that through something called the selective attention test. Now, what I'm going to do is I'm going to mute my microphone so that we don't get any feedback here. However, they do a really good job going through the text of what actually to do. But essentially, you're going to be watching two teams of players, one with black jerseys on, one with white jerseys on, and they're asking you to count, do not lose count of how many times the white team passes the ball. It's not a long test, but it basically, I watched this one time as I was studying neurology and motivational systems, and then it finally dawned on me, and I don't know why it took me so long, but this test really helped me figure that out, why there is such a divide, like specifically, like neurologically speaking, philosophically speaking, what the heck is actually going on here? And so it does matter. Okay. So check this out. Keep your eye on the team that's passing the ball in white. Okay. So for those of you who've already done that before, you're like, okay, what's the big deal? Okay. It's kind of interesting, right? So did you see the gorilla? There is about 15% of people that actually see the gorilla, but most people don't see the gorilla the first time they do this test. And here's why. Because they were given instructions to follow the ball of the white team. Now, because they were given instructions to do that, and because they wanted to be right, their attentional system was solely focused on that team counting. And even though their eyes work fine, and you can see that when they played it back and put it in slow motion, the gorilla walked in front of the screen in broad daylight, they're just like, I didn't see the gorilla. Because their attentional network primed their brain to only look for one thing, they completely missed the gorilla. So, well, what's the relevance in this case? It's pretty clear, right? Doctors are trained to look for certain things, okay? And doctors in the standard medical model want to make sure that you don't die of something acute, okay? They want to make sure that you don't die of something acute. So they're going to look at your data, your exam, and go, is this person going to die or not? Okay. And does this person meet the criteria for a disease process? And if they don't meet the criteria of a process that is something that's I can treat or that could kill them, then I don't even really care, because that's what I'm here for, to figure out. So that's one aspect. The other aspect is people that are in the alternative model often are looking for a particular technique or treatment that they can implement. And that technique or treatment that they can implement to help improve function is what they're looking for. So they may not look at a case and go, what's going on? They're looking at a case and going, what can I treat? And so I feel like my first job is to figure out what's going on first, and then make sure that the person gets to the right place to get the right treatment at the right time for long enough so that they can successfully navigate their problem and actually recover. So it's more of a transformative process when you do the right thing at the right time for long enough, rather than do a technique on somebody to improve function while ignoring the actual other issues, or not looking for them, or to really only look for something that's killing somebody or that's diagnosable in a disease process. Means that there could be a gorilla in the room, but they're watching the ball. Okay. So I want you to know that your doctors on your team are watching the ball. I'm watching the ball. And I think that there's a trait called openness to experience, that allows somebody to see things rather than to be looking for something and not see things. So that's the main difference between models here. One model says that these liver enzymes are not seriously elevated enough to warrant any further investigation. Let's just keep an eye on it. If it progresses, then we could do something a little more invasive. And you know what? I'm not saying that I'm right here. I'm not saying that, okay, we should definitely scare the crap out of this client and just make them freak out about their liver enzyme elevation and needlessly scare them. But I'm also not saying let's just ignore this and hope this doesn't progress to something that does require some significant medical intervention, like, for example, autoimmune hepatitis that would require taking it out, and getting another one. So that's the reason, I think, why doctors can't seem to agree. There's facts, and then some doctors can't agree on facts because their motivational system is based upon their training. Their training makes them blind to anything other than what their training allows them to see, unless they have a personal trait of openness. Now, a person could have a personal trait of openness, but they may not be open professionally. So it's not that easy. It's not that simple. But that is the reason I think is what's going on. And that's why so many people are so frustrated, because their doctors can't seem to get on the same page. So hopefully that answers that question. And I think that the solution is just continual communication between members on your team. And hopefully over time, they can start to agree. Everybody understands the strengths of the other practitioner. And ideally, that would allow for successful navigation through these different aspects of your care plan so that you can recover. So that is a really cool test. And our entire motivational system really is influenced by, or I should say this, what we're motivated by will determine what we can attend to. So that's kind of an interesting tidbit of psychology and neurology that I think is super relevant, because most of the people that are out there with chronic conditions are seeing people, multiple people, and are really not understanding why they can't get on the same page. Okay, so back to this case. So LDH, we basically essentially said, so if you wanted to know why your doctors aren't really seeing eye to eye, it's not necessarily because one doesn't care. It's likely because that they are stuck in a motivational / attentional model of bias. And unfortunately, just don't agree. That's the main reason. I don't necessarily think it's due to negligence or ignorance or some personal bias against a particular gender, a personal bias against children. I think often it's just simply this, and certainly those other things are out there. I try to give the benefit of the doubt to the situation to try to reduce the amount of frustration people experience. Okay, so back to this. So having consulted this patient again, they were able to get the AST and ALT redone. They were elevated, but slightly better. LDH was not done because the doctor didn't seem to think that LDH isoenzyme study was warranted. And the reason is because if LDH is elevated, it could be elevated. One of the 5 enzymes is related to the heart and white blood cells. Okay. One of the 5 enzymes is related to the lungs. Okay. One of the 5 elevated enzymes is related to the placenta, which she's not pregnant. Okay. Or the kidneys. Okay. One of the 5 is related to muscle, like just muscle in your body, like striated muscle that you use to like lift things, and not necessarily heart muscle, but heart muscle is one of the other 5, and then liver. So there wasn't any indication even on this lab, okay, which isn't valid according to this doctor, that there was a kidney problem. The kidneys look normal. The gallbladder looked normal. So it didn't look like there was steatorrhea or some sort of gallbladder obstruction. She didn't have any wheezing or shortness of breath, although we are in COVID, so it's possible there was an underlying COVID infection. Generally, that would show up in white blood cells again, though. And so that was normal, okay? She's not pregnant. She didn't have any severe digestive disturbance, so pancreas and placenta were off the table. Her kidney issues look fine. That's off the table, okay? This is likely a liver issue. However, if it was a red blood cell issue, then we would have seen elevation of bilirubin or elevation of or a depletion of red blood cells. That would be something called hemolytic anemia. So let's just kind of clinically walk through this for those of you who are interested in investigation and kind of how doctors pivot through things. Okay, if these 2 enzymes here are elevated, and GGT is also elevated, that would suggest some sort of gallbladder issue. So we can rule all those things out. Okay. If AST and ALT and GGT are elevated, but they are greater than 200, then that rules out fatty liver. So a lot of people have non-alcoholic fatty liver. That rules that out for her. Okay. Plus she would have like clay colored stool, floating stool, all that stuff, but that rules it out. If they're greater than 250, or less than 250, then that rules out, if the enzymes are greater than 250, she could have alcoholic fatty liver, okay? But they're less than 250. So it ruled out alcoholic fatty liver. And by the way, she doesn't drink, okay? If she had elevated GGT, which she doesn't, and she had elevated triglycerides and glucose, she might have fatty liver that is more like diabetic fatty liver. If she had low kidney function, then she could have kidney disease, but she didn't have low kidney function. If she had low cholesterol and low protein, then that could be chronic liver disease. So this is definitely an acute issue. So we ruled that out. Okay. So we basically said there's no hemolytic anemia, there's no chronic liver issue, there's no hepatitis related to infection from hepatitis A, B, or C, there's no fatty liver, there's no non-diabetic or non-alcoholic fatty liver. And so what are we down to? Well, we just don't know. With the elevated LDH, that's where the key is. She may have muscle wasting. She may have liver autoimmunity. And so basically, we need to run this LDH isoenzyme study or something called CKMM to identify if she has any autoimmunity to her muscles. Now, why is this important? Well, clearly this is elevated. She has confirmed thyroid autoimmunity, and she's undergone a tremendous amount of stress the last 6 weeks leading up to this testing. So it's kind of like, listen, if you're undergoing stress and you have autoimmunity, i.e. thyroid autoimmunity, that's going to promote your autoimmunity. Promoting your autoimmunity will negatively impact your cognitive domains through neuroinflammation. Promoting autoimmunity is likely to create more autoimmune targets, i.e. liver or any of these other targets. So there could be some subtle autoimmune presentation here that is significant, and we want to intervene as quickly as possible so that she can restore her optimal function. That seems pretty evident, right? So essentially, we've ruled out the worst of the worst. And so I think it's appropriate for other doctor not to do like serious testing, like biopsies, or to scare the bejesus out of her by saying that there's death that's imminent, because it isn't. Okay. And it seems like the other things that would be elevated that suggest serious pathology are essentially normal. The only thing that isn't normal on her labs is related to her thyroid autoimmunity. And so I suspect that she has another type of immunity here. And so what we decided to do was to run a LDH isoenzyme study if her liver enzymes come back elevated at the start of February. So I'll keep you posted on that. If you have any specific questions about the case, please write something in the comment section. I'd be happy to get back to you. I hope that you enjoyed this video, and I hope that somehow watching this video helps you be less frustrated with the back and forth that you experience between different people on your medical team, and understand that it's really due to a doctor's training, their own bias, and not necessarily due to negligence or ignorance.